Good morning. My name is James Atha, Communications Director for Public Health, Seattle and King County. We're here today to talk about additional measures being taken to reduce the spread of COVID in our community and save lives. Speakers today will include King County Executive Constantine, Washington State Governor Jay Inslee, Snohomish County Executive Summers, Dave Summers, Public Health Seattle and King County Health Officer Dr. Jeff Duchin. Also available for questions, Public Health Seattle and King County Director Patty Hayes and City of Seattle Mayor Jenny Durkan. Before I turn it over to Executive Constantine, we're doing a new system for media questions, and we're exhibiting social distancing ourselves. We have pool cameras in the room, and we have reporters calling in online. Following remarks from our speakers, we will take questions from reporters on the conference line. All lines will be muted during the briefing. We will then unmute the lines and call on individuals for questions. Please keep your lines muted until you are called upon. If there is excess background noise, we'll mute the lines again, so please remain muted until you're called upon. We will attempt to get to as many of your questions as possible. Now I'd like to turn it over to King County Executive Constantine.
Thank you, James. Good morning. As we begin another week of changes and challenges, and I'll remind you it was just a little over 2 weeks ago that we first gathered here when the outbreak was detected at the nursing home in Kirkland. A lot has happened at that time. As we begin another week of challenges, I want to first extend our condolences to the families of those who have passed away from this pandemic and our concerns for those who continue to recover. Now, as you know, last week we announced public health directives that were intended and are intended to slow the rate of infection in our community and to give our hospital systems time to ramp up and to prepare. I am grateful for the millions of people around this region who have answered the call, who've turned their lives upside down and changed the way they work and travel and provide for their families and the well-being of their neighbors. But it was clear to me late last week and over the weekend that we must do more, that not all people are practicing appropriate social distancing and good health practices in every situation. We are at a critical moment in this crisis. We're leaving the phase of COVID-19 outbreaks in concentrated areas of the county, and we're entering the phase of potentially rapid and widespread infection. As public health experts from King County and the state conferred yesterday on next steps, it became clear that we needed to update the local health order that we put in place with additional social distancing measures. Beginning today, March 16th, we will implement new directives governing events, restaurants, social establishments, retailers. These are serious actions, not taken lightly. These are tactics needed to provide for the safety of our community, and our public health officer, Jeff Duchin, will be able to speak more about the details in a moment. We will be continuing to consult with all of our cities. There are 39 cities in King County about additional actions they believe they need to respond to local conditions in their jurisdictions. I want to take a minute to thank Dr. Duchin, Public Health Director Patty Hayes, and their team. They are working around the clock for our community. It is time right now for people to assume that they and everyone they meet has been exposed and is potentially infected, to avoid any unnecessary interactions that might lead to further infection, and to wait and monitor and see if they in fact have been infected so that they can isolate and recover without presenting a danger to others. Go to work if you must, but hunker down if you're able. Postpone anything you can. Treat the next 2 weeks as a period of self-quarantine to protect yourself and the lives and health of your loved ones and of our community. I am well aware of the hardships we've asked our residents to endure. And while I'm heartened by the support and understanding of so many people across the region, I also appreciate the anxiety felt by many in, for example, the restaurant and entertainment industries. Back in World War II, there was a national push for people to buy war bonds. In that same spirit, I'm urging everyone to patronize their local restaurants and coffee shops at a safe distance. If this pandemic is symbolized by the medical mask, then perhaps our resilience is going to be represented by the takeout box. I also ask you to join me in supporting the arts. If you plan on donating to an arts organization anytime this year, please do it now and take the time to donate to one of the many charities that's helping the people who are employed in the arts to get through this period. People have been put out of work either because they're artists or because they work backstage in the arts, to be able to pay their rent, to be able to put a meal on the table. And if your event is canceled, whether it's a charitable event or an arts event, please don't ask for a refund if you can afford it. These organizations need those funds to get through this time right now. Consider your ticket a contribution to a worthy cause. We can all play a small part in helping our economy and our neighbors, helping them hang on until the day we can lift these orders and eventually get back to life as normal. Today we are focused on the response, but in the coming weeks we must also focus on the recovery. It is my honor to introduce to you the Governor of the State of Washington, Jay Inslee.
Good morning. I want to thank members of the media who are accommodating our need to socially distance. We appreciate your cooperation and not shaking hands and maintaining 6 feet to the extent humanly possible. We thank you for your leadership in this statewide and national effort. Given the explosion of the COVID-19 virus in our state and globally, I will sign a statewide executive proclamation later today temporarily shutting down restaurants, bars, entertainment, and recreational facilities. This order is operational for 2 weeks and obviously may be extended. The reason is quite clear. We represent about 2% of the population of the United States, but we represent over 20% of the infections. Today it's 796 infections. Never since World War II have we faced a situation like this where we both can be part of this battle, but must be part of this battle. This is bigger than all of us, and I am fully confident that Washingtonians will rise to this challenge to get back to a normal state of our life as soon as humanly possible. But all of us have to recognize for the next several weeks, normal is not in our game plan. And I will be announcing both mandatory rules in this regard and a request for Washingtonians to understand that central premise. As Dow said, these decisions are not taken lightly. I know there are enormous economic implications and social disruptions. And in the days to come, we will attempt to do everything we can to minimize and help mitigate some of these challenges. But today, we know we are doing this for a simple reason, to save lives of our loved ones in Washington. And I want to reiterate here, hours count. It's not that weeks count, hours count. And so we need very strong measures to reduce the extent and pace of this infestation. This is our only weapon available to us right now. I want to reiterate that. We are not powerless against this virus, but we have one effective means of defeating it, and that is distancing ourselves from virtually everyone else in the state of Washington. Restaurants will still be allowed to provide takeout service and delivery services, but no in-person on-site dining or drinking of alcohol or coffee or anything else will be allowed under this order. Sit-down food services at colleges will be prohibited, but they will have the ability to have what you might think of as grab-and-go or in-your-room dining. The ban will not apply, obviously, to grocery stores and pharmacies. Other retail outlets that can play an enormous role in this must designate an employer or officer to implement a social distancing plan for the operations of their business. So I want to go through what is included in this ban. Restaurants, except for takeout and remote delivery. Food courts, bars and taverns, coffee shops, donut shops, ice cream parlors, wine and beer tasting venues, breweries and distilleries, beauty salons, barbers and nail salons, tattoo parlors, theaters, bowling alleys, gyms and fitness centers, non-tribal card rooms, museums and art galleries, youth sports and youth clubs. Permitted to continue, among other things, are grocery stores and pharmacies. I do want to be clear about this, though. The supply chain is strong today, and grocery stores will continue operating and providing services to Washingtonians. And I want to thank people in that industry for working day and night to make sure that that will continue. We all are in this together, and we don't want to stress the supply chain unnecessarily. So when you purchase things, this is a moment to think of your neighbors, not just your immediate family, so we can keep this supply chain open. We're keeping open pharmacies, childcare and daycare facilities, school-based food programs for K through 12, convenience stores, and banks. As I mentioned, food or beverage services must move to delivery, takeout, or grab-and-go service, even at airports and in dorms. Additionally, all gatherings for social, spiritual, or recreational purposes with over 50 participants are prohibited, and all similar gatherings under 40 participants are prohibited unless previously announced criteria for public health and social distancing are met. Now, that is an order of the governor, but I want to speak to every leader of any organization, private or public. If you're thinking about having a group with 49 people in the same room, think again. You need to figure out how not to have meetings of any size if there is any possible opportunity to get your work done in a different way. We need your leadership more than ever to make sure that that fundamental common sense rule is followed. This morning, I spoke with other governors to the president and the vice president and some of that leadership. There was a wide variety of subjects discussed. The one that is particularly important to the state of Washington is the maintenance of our personal protection equipment for our medical system and our hospitals. This is something we are very concerned about. The federal stockpile that has hundreds of thousands of personally protective equipment has been responding to our orders, but we are going to have to increase our orders fairly significantly, and we need that federal stockpile to be able to fulfill our state stockpile. I was pleased that a request I made to the president will be granted, and that is that we change our national priority system so that we can get personal protection equipment in the state of Washington. Previously, the system essentially had an allocation as a certain percentage to each state, essentially on a percentage of population basis. I argued that that is not adequate to the task because we have 700 plus infections right now, and West Virginia essentially has none. So I believe the president will change that prioritization, and he said he would shortly, and I think this will facilitate Washington getting more personal protection equipment as soon as humanly possible. So that was helpful discussion, and I appreciate it. So here's kind of the rule going forward for all of us. It doesn't matter if we're a business leader or a working person or a grandparent or a grandchild. If we are living a normal life right now, we're just not doing our job as Washingtonians. It's much, much too dangerous. We can't do that anymore. We need to make changes to our personal and family lives, regardless of size. And think about where you're seated in all occasions. We have simply got to limit the number of people who come in contact with this virus. 6 feet between us ought to be the rule in every circumstance. Now, I want to say something really strong to some of our most loved ones. And those are the people who are age 60 and over, and those people who have some underlying health condition. You are at substantial risk because of this virus. Let me give you a reason I say that. We are fortunate that our younger population has a very low rate of infection or mortality if you are infected. The most recently available information is that if you're under 50, you might have a mortality rate of 0.4%, and it gets lower as you go lower on the age chart. But if you are over 80, the mortality rate can skyrocket to 8 to 18%. From the 70 to 79 provision, it is 8%. And if you were over 80, it is 14.8%. Anyone in this category, I want to make a very personal and gubernatorial request to you. You need to self-isolate, starting right now. And that means you need to change the way you operate your life. If you've every Saturday met your buddies after a basketball game like I did for 20 years, you just can't do that anymore. If you've wrestled with your grandchildren every Saturday morning like I've done for years, you just can't do that anymore. If you've gone to a museum with your friends on a Sunday afternoon, you just can't do that anymore. Now, this is not a legal statement by the governor, but it is as strong a recommendation as I can possibly make. And we as Washingtonians have to help our loved ones follow that admonition. If your grandma's going out, she's not going to go to the restaurant anymore because of this rule, but if she's going to an art gallery, no, you need to talk to her and say you're not going to do that for a couple weeks at least, and probably longer. And if you see them playing with your grandkids and wrestling on the floor, you can't do that. And we need to save these people. Because if we can keep this group of people out of circulation for the next several weeks, we're going to save dozens, if not hundreds, of our loved ones. So that group of people, I strongly recommend self-isolation at this moment. Now, those of us who are under 60 and are healthy, do not have underlying conditions, I also agree that you ought to look at your life and figure, what do I really have to do when I leave my house? I mean, what is really required for my family's health or general living? And if the answer is you really don't have to do it, stay home. You just got to stay home unless it's absolutely necessary to go out. And this is tough. Look, we're social animals. We want to be with our loved ones. We've spent, in my case, 69 years offering my hand to anybody I meet. But we can't do that anymore. Okay. I want to address our medical situation. We are very aggressive attempting to build our surge capacity in our hospital system. This is very difficult because unless we are successful doing what I'm suggesting, which is everybody stays 6 feet away from everybody else under all conditions, we're going to have a real strain on our hospitals. We have a plan to do all we can in this regard, but everybody's got to pitch in, including, frankly, you are going to, if you have really non-necessary surgery that could be delayed without a risk to your health, you probably are not going to be having those procedures for some period of time. And we're having discussions with our hospital and medical community about that just actually this afternoon. I want to thank Constantine, Jenny Durkan, Dave Summers and all the leaders with me. And I want to say that I'm really proud of what Washingtonians are doing right now. They are responding, and that's been very pleasing to me. I just want to finish by something that really inspired me the other day that I hope we keep in mind. Our Superintendent of Public Instruction, Chris Rakedahl, when we announced our school closure, told a little story about how he was watching a 14-year-old girl playing volleyball. I presume it was his daughter, and she really loves playing volleyball. And he said it was kind of troublesome to him that he realized that was the last volleyball she was going to get to play for some period of time, and she really loves the game. But as soon as he had that thought, he also realized she was going to get to play again. There was going to be a day where everybody gets to play volleyball and basketball. There is going to be a day when we can be close to our grandparents. That day is going to come. We are going to get through this. We do have the ability to control our own destiny, and I'm confident we will fulfill that. I want to ask everybody to help out in this regard. With that, our next speaker is Jeff. Are you coming up, or who's next here? Dave? Yes, thank you. Dave Summers, Snohomish County Executive.
Thank you, Governor. We in Snohomish County are focused on several objectives. First of all is science-based decision-making. And I want to assure all of you that every action that you've been asked to take and all the sacrifices you've been asked to take are guided by science and by the recommendations of our professional health officers and professionals that know about these types of viruses and conditions. So even though you may not know anybody that's sick, take these actions seriously, please. They are designed to flatten the curve of the spread of the disease, which is vitally important, not only for the health of vulnerable populations, but also to make sure that we're matching the capacity of our health systems to address the sicknesses that comes through our communities. Also want to say that we are working 24/7. We have a lot of good people working very hard to form partnerships, very strong partnerships, and I thank the governor and Dow and others for really pulling together on this as a team. It's vitally important that each and every one of us, whether you're a city or a county or a business or an individual, really is working together on this. We need each and every one of you. So in Snohomish County, we stood up our emergency management system 3 weeks ago to coordinate our efforts within the county between cities, the county, private businesses, our health district, make sure that each and every partner is focused on what they need to do and what our priorities are to protect vulnerable populations and flatten the curve. We'll continue to build those partnerships. We're very grateful for the assistance coming in from the federal government at this time, and that's a welcome addition to the team that we have here in Snohomish County and Washington State. The last thing I want to say is personal responsibility, and I am also very proud of our citizens. It's clear, and residents are very clear that you are taking this seriously. As I drove in this morning from Snohomish County, it was a quick drive. We thank you for that. For those of you who are not taking this seriously, we absolutely, each and every one of us, depend on you to really take actions, the actions we're asking for you. At the end of the day, we can have partnerships and we can be guided by science, but each and every one of you as individuals needs to take action. You need to self-isolate. If you're sick, stay home. Take care of your elders and others around you. If you see somebody doing something stupid, say something. And just rest assured that we're going to get through this as best we can, as quickly as we can. We're going to be all right. We've been through tough times before, but with our partnerships and your personal responsibility and being guided by science, we're going to do just fine. So get out. It's going to be a beautiful week here in Washington State. Is the only state in the country that's dry this week. So get outside, order some takeout, and just practice your personal distancing and cleanliness. So with that, thank you.
Good morning. I'm Jeff Duchin, Health Officer for Public Health Seattle and King County, and I'd like to start by thanking Governor Inslee, Executive Constantine, Mayor Durkan, Executive Summers for their leadership and for being coordinated in our response to this unprecedented challenge. COVID-19 cases continue to increase in King County and Washington State, and we expect the cases to continue to double every 5 to 7 days unless we take action to significantly reduce community spread. The only way to do this is by decreasing the total number of people who get infected and can spread the disease to others, including to the many vulnerable people in our communities, in our families. This is what we mean by flattening the curve, decreasing the peak, the number of people who get infected at the height of the epidemic, delaying that peak, and spreading out the infections over time. And although most of us won't get seriously ill, if we don't take decisive action, the number of people that require medical attention ultimately could exceed the capacity of the healthcare system. So we need to make sure that anyone who gets seriously ill, our friends, our family members, our loved ones, will have the healthcare system there and able to take care of them should they need it. In order to do that, we have to work together and ensure that everybody is understanding the social distancing measures that we need to decrease close contact everyone has with others in the community. This is the most important way to decrease the spread of COVID-19. And although we call it social distancing, it's really physical distancing. We need to stay apart from one another to the greatest extent possible. And it's very important to understand this is not just for older adults and people who have underlying health conditions. We need everyone, younger people, healthy people, people who don't care about their own health, to understand that what they do impacts the health of the whole community. And they, although they will likely do well if they're young and healthy, can increase the number of cases in the community inadvertently, which will result in more serious infections and a higher strain on our hospital system if they don't practice this distancing. So we all need to work together to ensure that everyone does whatever they can do to avoid all non-essential gatherings and close contact. And I want to thank the people who are actually taking the effort and making significant, difficult changes in their lives to help slow the spread of disease. And I also, again, want to extend my sincere, heartfelt condolences to all those who have had this disease and who have had family members impacted by this disease. We understand that this outbreak and the response steps that we need to take are tremendously disruptive to our lives. But it is critical to understand by taking these individual actions to keep yourself healthy and to avoid contacts with others, we are protecting not only our own health, but the health of the community, the health of those who are vulnerable, and protecting the healthcare system. The actions that we're taking today are going to impact what will happen in our community weeks and months from now. 5 days ago, we announced initial measures to help limit the spread of COVID-19, and today we're announcing additional steps that we believe are required to further limit close contact in our communities. And you heard from Executive Constantine and Governor Inslee what some of those steps are. The unprecedented health threat that COVID-19 presents requires unprecedented individual and community action and cooperation. The reasons we're doing this now include a continued increase in new cases. We know there's about a 2-week time lag between the time someone becomes sick and when they need hospital care, and waiting for the hospital care system to become overloaded is not an option. Our public health surveillance data show that there have been higher levels of emergency department visits and pneumonia than we expect at this time of year. Our flu season is winding down, yet we're still seeing levels of emergency department visits and pneumonia hospitalizations that are comparable to the peak of flu season. Statewide data from Washington State Department of Health also shows increasing visits and hospitalizations around the state for people with symptoms that might be suggestive of COVID-19. And as you've heard, there's a growing consensus at the national, state, and local levels regarding the need to take all available actions to delay and lessen the spread of COVID-19. We need to impress on everyone the urgency of this situation and the importance of taking both governmental and individual actions. Therefore, as local health officer, I'm ordering that beginning today, March 16th, all events with 50 people or more are hereby prohibited until further notice, consistent with that action the governor has announced. In addition, events with fewer than 50 people are discouraged. and they're prohibited unless their organizers can observe the COVID-19 prevention measures that we have described. All bars, dance clubs, fitness and health clubs, movie theaters, nightclubs, and other social and recreational establishments shall be closed until March 31st or later if determined necessary. In addition, until March 31st, 2020, or later if determined necessary, all restaurants and food establishments shall cease providing dining room services but may remain open for drive-through, takeout, and delivery services and must adhere to the COVID-19 public health guidance for retail businesses and service operators. All other retail, including banks, grocery stores, hardware stores, and pharmacies, should and may remain open, provided they observe the COVID-19 prevention measures and adhere to the Seattle and King County guidance for retail and service operators. At this time, I'm going to conclude my remarks and will be available for questions.
So, as was described at the beginning, we do not have a full complement of reporters here. There's a pool camera. We are receiving questions remotely, and Chase, I wanted to have you sort of MC this part of it and make sure that we get the questions through from the reporters in an orderly way.
Sure. So please, everyone, remain muted unless you are called upon. We're going to unmute all the lines now. And first question to Rachel LaCourte, AP.
Not hearing Rachel.
Are you taking questions?
First question to Rachel LaCourte.
Thanks, Chase. Governor, what are some things that might be done by the state to help employees and businesses who will be seriously impacted by these closures? And separately, do you believe the federal government should step in and give displaced workers direct monthly checks, like a universal basic income, to help them through the shutdowns, as some have suggested?
Yeah, the question is, what can we do to help displaced workers and businesses that will be affected by this order? First off, we are going to be intensely interested to look at any potential way that we can help displaced workers and businesses. At this moment, the one thing I can tell you for sure that we are going to do is have our paid sick and family leave policies, the best policies in the United States, which are Washington policies, strictly enforced to give people every possible opportunity to be taken care of in their economic needs. Second, I believe one of the most important things that can happen is for the federal government to allow pandemics to be considered epidemics, or disasters, excuse me. If the Congress changes, or if the president changes these rules, we can open up the unemployment compensation window not only to the vast numbers of people who currently will be able to get unemployment insurance, but it would dramatically increase the numbers who could be protected to those who work part-time and have small numbers of hours. So we will be talking to our congressional delegation and the administration in the hopes that they can do that. Any possible way to expand unemployment compensation ought to be something that we look at. Third, we have $200 million that's been appropriated by the state legislature, and we will look for avenues to use that, both potentially for affected employees and businesses. We cannot specify what that possibly could be, because as you can imagine, we have hundreds of millions of dollars of requests for those dollars today in taking care of those who need isolation, in purchasing new medical supplies for our hospitals and physicians, acquiring PP&E, building systems so that the unsheltered don't have epidemics that go through our homeless shelters. The list goes on and on and on. So what we're going to do, Rachel, is do all we can to look for creative avenues to help folks. And in the days to come, we hope we can be more creative in that regard. In regard to the proposal that we go to some basic guaranteed income on a federal level, I certainly would not be opposed to that. We would be in favor of anything that can give additional protections for those who are going to suffer because of this virus. But I do think we have existing mechanisms to get money into the hands of people right now through the unemployment system if we, in fact, make sure it's available to everyone. So, again, I want to reiterate how tough this decision is. I used to work in the food service industry. I was a server at Clinker Dagger Bickerstaff and Pets Public House when I was a college student, and I knew how much that cash meant to me on a weekly basis. So we're going to look for every creative solution that we can find.
All right, next question, Sydney Brownstone from Seattle Times. And again, please keep your lines on mute until you're called on, and we will get through this. Sydney?
Hi, Hi. I have two questions. The first is that the Seattle area has the third highest unsheltered homeless population in the country, and many lack access to basic hygiene services. What are you doing to address this, and is it wise for jurisdictions to continue encampment removals amid this outbreak?
So there are several of us, Sydney, who can address that question. We are de-intensifying our shelters by creating more space so that we lower the risk of infection within the shelters. That is commensurately increasing the opportunities for hygiene. It is a challenge that Seattle is taking on, and Mayor Durkan, you may want to speak to that. It's a challenge we're taking on countywide. Patty Hayes, our Director of Public Health, has been working along with our Human Services Department and facilities on that challenge. And our goal is that we will provide even those who are unhoused with the opportunity to be safely separated from others, to avoid infection either inside the shelters or out in the community. And if anyone is identified as having been infected, that we're going to provide them the same opportunities for isolation that we're providing everyone else. I don't know if anyone else would want to speak to that. Mayor Durkan.
So I want to thank Executive Constantine and his team. We've been working for the last 2 weeks very intently on trying to stand up a system for sheltering our homeless, and it's been with three things in mind. One, to get people inside as quickly as possible. Two, that the people are inside have enough space that they can social distance and disease does not spread. And three is to set up a system of shelters and isolation and quarantine units for those people. We do this for two reasons. One, because it is a humane thing to do and the right thing to do for the people who are living outdoors, but also because we need to make sure that we protect our public health system. And if there were to be a significant outbreak within the homeless community, we know that that could have a huge impact on our hospital system. I've talked to the governor and the vice president about this. They are working at every level to make sure, because as much as Seattle and King County work to do this, we will need additional resources, including those of the state and the federal government. So it is one of the highest priorities right now for all of the leaders in the state.
All right, next question, Natalie Swaby, King 5. Go ahead, Natalie.
This is Jerry Cornfield from the Herald. Can we ask a question?
Hello?
Natalie, are you there?
Oh, yeah, Natalie Swaby from King 5. What will happen if someone defies this order? What are the penalties?
I really believe the vast majority of Washingtonians are going to respond to this order. The reason is we understand science in Washington State, and the science is clear that this action is absolutely necessary to the continuation and the rebirth of our economy and our culture and our family life. Number two, we love people and our loved ones, and we understand that in order to protect our loved ones and the people around us, these actions are absolutely necessary. Now, if there is a willful, conscious disregard of this, the state does have abilities to take legal action, both to get injunctions against people, and it is a crime to disobey this order. But we need to rely on our love for each other much more than our fear of the law at this moment. And that's why I believe we're going to be successful in this regard. And I see these acts of kindness and graciousness and community spirit popping up all over the place, for young people, watching out for their grandparents, to neighbors walking around the neighborhood asking folks if you got enough, this and that. And I know people are trying to help each other out. I'll just tell you, one neighbor, I went up and see how she was doing because her husband has some health issues. I wanted to ask her how they were doing yesterday. And she said that she actually was out of toilet paper, and so she did have to make a small order. So she ordered about a dozen rolls of toilet paper from a takeout outfit, and they were delivered in these giant boxes about 6 feet tall because she didn't know she'd actually ordered commercial-sized toilet paper. So our neighborhood has a stockpile right now, and I'm glad we're taking care of each other.
Okay. Next question, Hannah Scott, Cairo Radio. Hannah Scott?
Hi, I'm here. Can
Yes.
you guys hear me? Okay. Governor, can you speak at all as to whether there's loan relief, suspension coming of mortgages, car payments, rent, anything on a statewide level that we're doing to deal with that?
We are considering options in this regard. We do not have a specific notice today, but we are exploring every meaningful option to try to get us through this difficult period. So I would hope that we have some news on that in the upcoming days. We're going to be creative as possible so that we can get through this, because again, this is a temporary issue. Our economy is going to rebound, but we want to help people to the extent possible. So we'll have more to say in the upcoming days.
Okay, next question, Erica Barnett. Erica? All right, moving on, Patrick from Como. Patrick from Como, are you muted?
Can you hear me? This
Yes.
question's for Jeff Duchin. When considering the length of the shutdown, I know March 31st is that deadline. What indicators are you going to be looking for that could lift this after that? Is it kind of number of infections or number of deaths? Is it how long this curve is flattening, or if it needs to flatten more? How long could this go?
Yeah, it's a good question. The outbreak is likely to go for months. And whatever we do today, we wouldn't expect to see that impact for at least a month. So we won't be able to look at the numbers of cases 2 weeks from now and tell us whether this or any of our strategies are effective or how effective. We know from experience in other communities and other countries and past outbreaks that these types of measures are effective at decreasing the peak and pushing back the onset and spreading out the numbers of infections over time. I think we'll be primarily reevaluating the logistical issues associated with the implementation and seeing how we can do better, if we need to do better, if we need to do more in the context of what we're observing in the community with respect to people coming together, how successfully we're keeping people and people are exercising individual responsibility and complying with our intent.
Okay. Next question, Chris Daniels, King TV. Chris, go ahead. Chris? All right, moving on. on Hannah Weinberg.
Can you hear me now?
Oh, go ahead, Chris.
All right, there's a little bit of a lag there. My question is for Executive Constantine. Over the weekend, there's been a couple of new spots that the county has taken over in Issaquah and in Bellevue, and given the concerns that were expressed last Friday in Kent, I'm just wondering how these locations will be managed from a county perspective, and also whether you feel like you need any additional backup in, like, say, the National Guard to guard these particular locations.
Thanks, Chris. First off, these facilities that we've identified, including the new locations in Bellevue, Issaquah, Boeing Field, and elsewhere, are still just the beginning of the capacity that we're going to need as we look toward a peak of infection some 6 to 8 weeks from now, a peak of demand for hospital space and a peak of demand for isolation and quarantine space. I'm very grateful to the mayor of Issaquah and the people of Issaquah who've responded in a very level-headed and community-minded way to this announcement. I am anxious for us to continue apace in the standing up of these facilities in every corner of King County, and it is a fact that we're going to need outside help in order to be able to staff them. We're pulling all of our personnel to help with these core functions. If we need someone to simply attend a facility to help make sure the residents are getting their groceries ordered in, to do those sorts of activities, we're going to need people from outside, and whether that's the National Guard or people from nonprofit organizations. That element is critical. We just don't have the number of employees we need here at King County to be able to handle that. Director Hayes, I'm wondering if you can speak a little bit to the potential uses of those sites.
Thank you. Great question. So I am partnering with our Department of Community and Human Services to set up the system so that as we see the need for people to be placed in these various facilities, that we are staffing those facilities commensurate with the needs. So as we look at each facility, and I was out at the Issaquah Motel site yesterday looking at that and what is the best use for that or multiple uses, we are working on the list to staff those. So for example, the Kent Motel will have mental health as well as someone who can be on site there so that individuals have resources available and the support that they need. So we are looking to institute more support in these facilities, but I want to emphasize that the opportunity to partner with the community when we open a space, both for the needs potentially that we may have, as Dr. Duchin was talking about the hospital surge and what we may need to look at for staffing and care for individuals who no longer need hospitalization, but also need continued help and assistance while they continue their recovery is one point. I know the one thing that local communities are interested in, as we follow what the governor and Executive Constantine outlined, we have families who, for example, have multiple generations living together, or families living in a situation where they're wondering, is there an alternative for either their elder or another family member who may need some help in self-quarantining themselves or isolating themselves. So we want to work with those communities, and if our facilities that we're trying to set up can accommodate that, we want to do that. Thirdly, with the acute need we know that people have experiencing homelessness, we're looking at what structure can we do to both help them when they're symptomatic and need nursing support as well as mental health support, as well as if they are diagnosed with COVID, where we can have them in a supportive and caring site so that they are having their course of the infection watched and taken care of. So we're doing all these at the same time, building this system. We're actually testing a system that is different than the clearly we have seen around the country. I was grateful for the partnership with the Healthcare Authority, who actually did the site visit with me yesterday to take a look at what are the additional things that the Healthcare Authority, as the major Medicaid agency, can help and support with. So it's that working together that we will figure out how to build these different sites and staff them.
Thank you.
Let me add something to
Governor.
this, if I can. I really appreciate the leaders of Issaquah who have facilitated this. And I just want to make the point that we can all understand why people would be anxious if one person walked away, who turned out to be not positive, by the way, into our neighborhoods. Those aren't the people you need to be afraid of or concerned about. You need to be concerned about your best friend or your family when you got a 65-year-old person with respiratory problems and you're hanging around with them. Those are the people we got to worry about right now. And we're not going to be able to send the National Guard to protect you from your own decisions, which can put you and your family at risk. So we got to see our family members as people that we got to put on pause a little bit when we hang with them. And that's a solution. We got what I call the Washington Guard, which is everybody in the state of Washington.
So we're going to go another question, and I'm going to ask Dr. Duchin and Mayor Durkan to say a couple words, and then we'll conclude with a thought from Governor Inslee. Go ahead.
All right, last question, and if you still have questions after this, please just email either the governor's office or the executive's office, and we will get your questions directed to the right people for an answer. Thanks for your patience.
Hello.
So this is going to go, last question to Erica Barnett.
What?
Erica.
Hi, this is Erica Barnett. Question about the homeless population. Governor Inslee said that people over 60 or with underlying health conditions need to self-isolate. Why are large congregate shelters still staying open, given that a large portion of the homeless population fits that description?
Hi, this is Patty Hayes again. As I said, one of the things in our partnership with the city and the work that they're doing to what we've called de-intensify the shelters is to look at expansion of the shelter capacity by having people be able to social distance, but with more capacity there. That's a really important first step that the city's been just an incredible partner in looking at where those facilities can be. Then the next piece is the more intense area where we know we need to have more staffing, et cetera. So we're working with all the shelter operators on this, and we want to do our best for everyone to get through this time.
And I'll just add on to that I mentioned Boeing Field. We're using space at Boeing Field for the very purpose of de-intensifying a shelter that's specifically for older and more fragile adults. And that is going to offer us the option not of simply closing the shelter and sending them out onto the street, but providing a higher level of care where they're more separated from one another, both at the existing shelter and at the Boeing Field facility. Dr. Duchin.
I just wanted to take this opportunity to ask for your help in getting a few key messages out to the public. I don't want our core message around staying away from people who are sick, good hand hygiene, don't touch your face, and not going to work or school, and this intense social distancing that we need to all partake of. I don't want that to get lost in some of the other conversations that we've had. That individual responsibility is critical, and to help support that, we have good information on the Washington State Department of Health website that we've collaborated on. I encourage the public to look there for information on what to do if they've been exposed to someone with COVID-19 or they themselves have respiratory illness and they want to know what to do. And in addition, we have new guidelines for our healthcare providers to help them use the testing capacity that's becoming increasingly available in our community the best way possible. Also on the Washington State Department of Health website, we know that we want everybody to have access to this information, so whatever you can do to help us push that out would be greatly appreciated. Thank you.
Mayor Durkan.
I just want to say a few things. First, I really want to thank the governor and Executive Constantine for their steady leadership. For Executive Summers and all of us have been on the phones with leaders up and down the I-5 corridor and east to west. We are speaking with one voice so the citizens know what to do. I think that this has really helped us. I also want a couple things in Seattle and throughout our region. People are still having heart attacks. They're still having catastrophic injuries. We need to preserve our healthcare environment, not just for people who might get COVID, but for those incidents. So that means protecting our healthcare workers. It also means, if you can, give blood. Our blood supply is dangerously low, and so if you can, that's another thing you can do. Also, every city is going to have to adjust to the reality. We're working in Seattle with our public health partners, with the governor and the county, to determine whether in the coming days we may need to do additional restrictions. Please, everybody, the number one thing you can do, stay home if you can, keep your distance. And for those who get takeout, I would say in Seattle, I urge you. That doesn't mean, even though it's beautiful out, you just all go to the park and have your dinner there together. It really means you can't congregate there. You can't have your parties in the park. If this disease hits, about 30% at least or more of the Seattle area in Washington State may get it. That means we won't have as many first responders. It means we won't have as many people collecting garbage. We have to maintain the health of our city and our region in every way we can. And I echo what Governor Inslee says. I have seen thousands of acts of kindness and compassion, but we all need to do more. The first line of defense against this virus, there is no vaccine and there is no treatment. It is each of us making smart choices. So thank you very much, everyone in Seattle and the region, for doing your part.
I too want to thank Governor Inslee. Governor, I want to particularly thank you for your personal and impassioned plea to older Washingtonians, to those who are in frail health, to protect themselves, and to the rest of us to help protect them. As you know, I have elderly parents. It was a challenge at first, as it is for everyone, to get them to change their behavior, but they're now learning to use FaceTime. So they're able to talk with their little 5-year-old granddaughter. You don't have to just stay cooped up in your home. Walks are okay. Going for a bike ride's okay. Going for a run is okay. It's even okay to go for a short drive as long as you don't go so far away that you have to stop and use a public restroom. But it is critical that you check in on others, whether you're calling them on the phone or contacting them online. Isolation is going to be very difficult for people as we are taking these determined steps to try to avoid direct physical interactions. So can you check in on your neighbors, on your friends, on the elders in your community? Make sure they have what they need, but also just make sure that they know someone cares. It's going to be really critical over these 2 weeks. Please stay safe. Governor Inslee.
We all have someone we think about. This morning, I'm thinking about my old basketball coach, Walt Milroy. He's 100 years of age, and he's still in good health and totally with it. And I love the guy. And we're here today saying we got to protect him. I'm here protecting my old basketball coach. I hope everybody's going to think about the people they're going to be protecting by reducing their social interactions, by protecting older people from not going out. Now, I'll just close on this comment. My great uncle was an executive on a submarine during World War II, and he got a Bronze Star because some of his courage he displayed when they sank an enemy freighter. A lot of people in the next several weeks are going to do some really good things for our state, and not a single one of them is going to get a medal. There's going to be no medals for people making good decisions here in Washington State. But I can tell you, if we make good decisions, we're going to feel proud of ourselves. We're going to be proud of our families and our communities and our businesses, and we are going to have the highest distinction anybody has, which we're stalwart Washingtonians. So let's be that, and let's do that. Good luck. Wash your hands.